Hi you guys, I am back. As you can see by the title of this video, it is called Panic Disorder. So I'm going to explain to you in this video a lot about panic disorders. 'Cause a lot of people don't know a lot of stuff about it. So now I'm going to explain it for you guys. And in the description of this video, there will be a phone number, a link, and a few other things for you guys to get more help. So let's get started. Panic disorder is a type of anxiety disorder. So it's basically if you have a panic disorder, it's basically it's basically the same thing as anxiety disorder, and I have a video about anxiety. So you can go check that out. Anxiety disorder, it causes panic attacks, which are sudden feelings of terror when there is no real danger. You may feel as if you are losing control. You may also have physical symptoms such as fast heartbeat, chest or stomach pain, breathing difficulties, weakness or dizziness, sweating, feeling hot or cold, chill, numb hands, tingling in your hands. Panic attacks can happen anytime, anywhere, and without warning. You may live in fear of another attack and may avoid places where you have had an attack. For some people, fear takes over their lives and they cannot leave their homes. Panic disorder is more common in women than men. It usually starts when people are young adults. Sometimes it starts when a person is under a lot of stress. Most people get better with treatment. Therapy can show you how to recognize and change your thinking patterns before they lead to a panic. Medications can also help you. So, that's what it is, but I'm gonna go a little bit more depth into it. That was just a little snippet. But yeah, so go to your doctor, and see if, you have it, you know what I mean? It starts young. It's just like anxiety. So if you have anxiety, then like you may have this. So I hope this video is teaching you, a little bit about it. So now let's get more into like depth into it. A panic disorder is a condition in which a person has episodes of intense fear or anxiety that occur suddenly, often without warning. Suppose one day you're getting out of your car to go to work. Suddenly, your chest feels tight. Your heart races. You begin to feel dizzy and faint. You start to choke. You feel as if you could be dying. Was it all in your head? No. Most likely, you had a panic attack. Panic attacks can last from minutes to hours. They may occur only once in a while, or they may occur quite frequently. The cause will trigger for these attacks may not be obvious. A diagnosis of panic attacks is usually made after a person experiences at least 2 panic attacks that occur without reason and are followed by a period of at least 1 month of fear that another attack will happen. Panic attacks can lead to PHOBIAS if they aren't treated. A phobia, What is a phobia? A phobia is an extreme, unreasonable fear in response to something specific. There are lots of different phobias, including fear of crowds, bridges, snakes, spiders, heights, open places, or social embarrassment. A phobia is also considered a problem when it keeps you from living a normal life. An example is being afraid to leave your home because you are afraid of uh, of the things listed that I just one of the things I just said. Symptoms during a panic attack. Panic attacks are assigned with physical symptoms that include shaking, trembling, feeling that your heart is pounding or racing, sweating, chest pain or discomfort, shortness of breath, feeling that you are choking, nausea, cramping, dizziness, or weakness, an out of body feeling, tingling or numbness in your hands, arms, feet, or legs, chills or hot flashes, signs of um dream dreamlike situations. A person may also have an extreme fear of losing control, going crazy, or dying during a panic attack. It is very rare for a person to have all of these symptoms at once. However, the presence of at least four symptoms strongly suggests that a person has a panic attack. Many of the symptoms that occur during a panic attack are the same as the symptoms of diseases of the heart, lungs, intestines, or nervous system. The other diseases may add the person's fear and anxiety during and after a panic attack. For example, you may believe that you are usually having a heart attack, but really you're not having a heart attack. Having a panic. You're having a panic disorder. Just the fear of having a panic attack is often enough to trigger the symptoms. This is the base for a condition called agoraphobia. A person who has agoraphobia finds it difficult to leave home or another safe area because he or she is afraid of having a panic attack in public or not having an easy way to escape if the symptoms starts. Should I see my doctor if I'm having a panic attack? Many people who have panic attacks don't seek medical care because of the embarrassment or the fear of taking medication. If you have a panic attack, it is very important to seek medical care and discuss your problem with your doctor. After you have been involved thoroughly, your doctor will be able to tell you if your panic attacks are related to panic disorder or are caused by another problem. Simply treatments are available to help control panic attacks and panic disorder. Several medications can help make panic attacks less severe or stop them altogether. Um, can counseling help people who have panic attacks and panic disorders? Yes. Several kinds of counseling are very effective in treating panic attacks and panic disorders. You can ask your doctor about the different kinds of counseling that are available. Counseling does not work as fast as medication, but it can be just as effective. The combination of both counseling and medication seems to be an effective treatment to panic attacks and panic disorder. How long does treatment last? It depends on you. Stopping panic attacks completely is a reasonable goal. Your doctor will design a treatment plan just for you, a treatment period lasting at least 6 to 9 months. Usually recommended. Some people taking medication for panic disorder or able to stop treatment after only a short time. Other people need to continue treatments over a long period of time or even for their lifetime. And so, that is a panic disorder. So I hope you learned a lot from this video. If you have, please write in the comments that you have. Hit that like and subscribe button. I hope you enjoyed this video. I hope you learned, from this video. So until next time, bye you guys. Don't forget that there will be a link in the description for more information for you guys.